are titled HIPAA HITECH Compliance, How to Be Ready for an OCR Audit. Today's presenter is Anupam Sahai, co-founder and president of eGestalt. Anupam is an accomplished management, marketing, and technology leader with 21 plus years of experience directing teams to develop and launch globally renowned products, generating up to $350 million annually. Prior to eGestalt, Anupam was Vice President Marketing for IXIA Inc. He's a recognized expert in the areas of healthcare IT, cloud computing, security and compliance, networking, and is a featured speaker at several industry conferences worldwide. If you have any questions, please send them via the questions function in GoToWebinar, and we will address them at the end of the presentation. If you'd like a copy of the presentation, please send an email directly to Anupam. His contact information will be given at the end. Thank you, Anupam, for presenting, and I'll turn the webinar over to you now.
Thank you, Mike. Good morning and good afternoon, everybody. So a list of topics that I will cover today. I'll start out by talking about HIPAA HITECH requirements and also incorporate some of the latest omnibus requirements that have come in that are deemed to be implemented starting September 26th. And then I'll talk about what are the OCR audit requirements, what is HHS and OCR looking for when they are auditing a particular company or a business. And then I'll kind of change gears and talk about 10 best practices that are required for a HIPAA HITECH security and compliance plan. This is based on our experience, based on interaction with number of folks. Some of them are in the call, I guess. And then I'll talk about 9 steps that you can take as a business to prepare for an HIPAA HITECH audit, which will more than meet the requirements of what the OCR is looking for, but go beyond that in terms of establishing a security and compliance program and be very, very up to speed with respect to what OCR is looking for. And then I'll talk about Edify Secure GRC, which is an automated tool which allows you to manage end-to-end security and compliance management, followed by concluding remarks and Q&A. As you can see, I have a lot of topics to cover here, and I'll try to go through them quickly. But if you want to get into specific points of discussion here, happy to have a separate call with you or have a follow-up discussion with you. Before I begin, I just want to say that information about HIPAA and HITECH continues to evolve pretty much by the day. And so while we've made every effort to ensure that the information is correct, there is no such assurances, and we expect you to follow your legal counsel's help for any definitive needs. So let me start out by giving a little bit of a background, establish some vocabulary that that all of you would keep hearing from me. So HIPAA stands for Healthcare Insurance Portability and Accountability Act. HITECH was the follow-up act from the HIPAA Act that was enacted in 1996. HITECH got enacted in 2009 as part of the Recovery Act. And some of the acronyms that I keep referring to: HHS stands for Department of Health and Human Services. OCR stands for Office of Civil Rights. It's the enforcement agency of HHS that's responsible for ensuring compliance with the regulation. PHI and EPHI refers to protected health information. If it's an electronic form, it's EPHI. CE stands for covered entity, and BA is a business associate. So what were the reasons, objectives for enacting HIPAA HITECH? Certainly technology was not the key driver. It's a means to an end. But really the overall and the overarching objective for enacting HIPAA HITECH was to improve healthcare coordination and administration, improve efficiency, improve the quality of healthcare, and thereby bring down the cost of healthcare administration. And in order to do that, what that requires is to bring in technology to help achieve some of the objectives that I talked about, help achieve sharing of information across providers. And so technology is a means to an end to achieve some of the objectives there. And when you bring in technology, when you bring in things like electronic medical records, which allows portability of patient information, a side effect of that is that there needs to be adequate security and privacy protections for personal health information, which is now available electronically and exchanged electronically over the web or internet. Excuse me. So who is a covered entity? Anybody who does deals with patients. You can see the list here. This is from the HHS site. Doctors, clinics, psychologists, dentists, etc. are defined to be a covered entity. Even a health plan provider or a healthcare clearinghouse is deemed to be a covered entity in that they deal with patient record information and they deal with protected information. So let's jump to the HITECH Act and some of the HIPAA omnibus rules that came out a few weeks ago. And there are some, excuse me, I have a bad throat. So there are some game changers that are part and parcel of the HITECH Act and the HIPAA omnibus rule. So what are those? One is that periodic audits can be done, and this includes auditing covered entities, not only covered entities, but business associates and their subcontractors. So across the board, across the responsibility chain, as you wish, people who deal with patient records are deemed to follow HIPAA HITECH requirements and can be audited by the government, by OCR. The fines have gone up from the HIPAA days. As we move to HITECH and HIPAA Omnibus reinforces that, the fines have gone up from $100 to $50,000 earlier to now $1.5 million per incident. And there are new criminal liabilities. HIPAA Omnibus also clarifies that there is no upper limit in terms of the number of times the fines can be imposed, and it is a function of the number of incidents of not following the requirements. And there are some incentives put in place as part of the HITECH rule, which allows whistleblowers and other people who are enforcing HHS to report the incidents to HHS, thereby they get a share of the proceeds. And the intention here is to provide a mechanism for enforcement that may or may not be done by OCR directly, but through other means to ensure that the requirements are being met across the board. And the state auditor generals are empowered to bring civil actions on behalf of the citizens if they report to the state auditor general. So it's a pretty broad set of requirements and enforcement that is permissible as a result of the HITECH Act and the HIPAA Omnibus rules. Now, some of the key changes that really changes the game is the responsibility chain, or the liability chain, if you wish, where the business associates are now statutorily obligated, along with the subcontractors, to implement HIPAA HITECH. And there's a shared responsibility that covered entities also have to ensure that the BAs and subcontractors that they work with are indeed taking steps to protect PHI information. So this is big because it kind of expands the reach and the impact of the HITECH Act and the HIPAA Omnibus Act, not just from covered entities, not just to the covered entities only, but also expands it to include business associates and subcontractors. And then the data breach notification requirements, which were changed in HITECH, have been reinforced in HIPAA Omnibus, which requires that if there is a breach involving 500 records or more, that needs to be reported to HHS within a certain period of time. If there are breaches that involve less than 500 people, then they need to be reported at the end of the year. One way or the other, it's important that the breaches are being notified to not just the government, but also to the end patients or customers who are involved in the breach. So the business associate definition, as I said earlier, is now in the purview of HIPAA HITECH Act. And the definition of business associate really is anybody who deals with PHI, either accessing it from a covered entity or otherwise, needs to ensure that HIPAA HITECH compliance policies and HIPAA HITECH security and compliance plan is in place. And these include service providers, MSPs, channel partners who work with them to manage the IT infrastructure. It includes hosting providers, accountants, lawyers, even garbage collectors. So it's pretty much anybody who deals with PHI information needs to ensure that they are HIPAA HITECH compliant. And as you can see, there are a huge number of players, pretty much anybody who deals with medical records. Certainly the 700,000 odd covered entities need to follow HIPAA HITECH compliance, but there are millions of BAs, literally about 2 million plus business associates and their subcontractors who are now required to be HIPAA HITECH compliant. And not to mention other kinds of compliance such as PCI or SOX or FSMA that they need to comply as well. And of course the government has put together a carrot to ensure transition and adoption of HIPAA HITECH, which is the $28 billion grant, federal grant for implementing EMR by showing what is called meaningful use. And I'll talk about that as we go forward. So the question comes is that, should we really care? Are the breaches happening there? Is this something that we need to be worried about? Yes. The short answer is yes. The breaches are happening pretty much by the day, by the week. Some larger notable ones that you see here are involving state level or county or state hospitals, like TRICARE is the Veterans Hospital, and that got hit with a huge lawsuit by the patients as a result of the breach that happened. So the result of a breach is not only damage to the brand, but as per the HIPAA HITECH laws, the customers or the patients can turn around and legally sue the covered entity or the business associate for privacy and security breach, along with the government coming after the CEs and BAs as a result of the breach. So it's a pretty wide net in terms of what the requirements are, and it's the responsibility of the covered entities and business associates to show that they have taken reasonable efforts to ensure HIPAA HITECH compliance and security if they want to deal with such incidents. So here are some news clips which show that the breach incidents are pretty pervasive. Literally 6 million individual records were compromised in the first year of HITECH launch. Some state level breaches are shown here: Utah, Alaska. These were breaches that happened at the state level, where lots of records were breached. And the latest tally that's shown here as of March 2013 comes from the HIPAA HHS site, which shows a running tally of the breaches that are happening every month. As you can see, roughly about 700 to 900, some 992, I guess, is the highest number. Number of incidents happens every month, and OCR essentially investigates them, and about 25% of them are acted on in terms of fines or remedial action. And so this is a pretty commonly occurring set of incidents, unfortunately, because of the breaches and the sophistication of the attackers and the hackers who are getting more organized and sophisticated by the day. This is called the HHS Wall of Shame. which is another way to say that when the breach incidents are notified to HHS, they put it up on the website, and it's pretty interesting. If you go through the list of notified breaches here, it includes businesses of all size, from one or two employee businesses all the way to large hospitals. It includes covered entities. It includes business associates. So it's pretty diversified in terms of people who are reporting breaches to HHS. And you can see why. Roughly about 50% of the breaches happen because of business associates losing data or business associates getting breached. And as I said earlier, both business associates and covered entities have a shared responsibility and liability to ensure that the patient health information is protected and secured. So this is pretty grim. Now, I touched upon the fact that the government has set aside federal stimulus grant money to the tune of about $28 billion to increase the adoption of electronic medical records. And in order to get the money, what businesses need to show is something called meaningful use, which essentially means in simple terms that if the government is paying for them to implement electronic medical records, they need to show that they're using the technology in a manner that protects the privacy and security of their patient records. So a requirement to show that essentially involves doing what is called a security risk analysis. And that involves dealing with security requirements. It deals with HIPAA HITECH compliance requirements, and takes about 70% of the time. And that's another tool that we will talk about, a tool that helps you automate doing the meaningful use security risk analysis to help get you the money from the federal government. So let me jump right in now into defining what is PHI, what needs to be protected, and what are the basic elements of a security and a compliance plan. What are the best practices that a typical business needs to implement? And again, these are the core aspects of a comprehensive security and compliance plan in terms of best practices. And then I'll jump into the HIPAA OCR audit requirements and what can you do as a business to deal with such an audit eventuality if it ends up happening. So PHI, the definition of a protected health information, is fairly broad. It deals with health information, but it also deals with personal information, such as name, address, birth date, social security number, or anything that can lead up to a particular individual. And that's pretty broad. That needs to be protected. Okay, sorry about that. So the key tenets of the HIPAA HITECH privacy and security rule are the following. There are four categories of things that need to happen. There are a set of administrative procedures, the physical safeguards, the technical services, and technical mechanisms. And these are essentially around protecting how PHI is stored, how it is accessed, how it is transmitted over the internet for sharing purposes, or how it is secured within the premises so that only the authorized people are able to access it and not misuse it. And from the security perspective, what this means is that when the PHI information, whether it is sitting on a server or it's being transmitted via fax machine, via the internet, no matter how PHI is stored or transmitted, it needs to be secured. And whatever be the device, whether you're accessing it on a mobile device, on a VPN network, the requirement is that PHI information needs to be secured, potentially encrypted, that allows an eavesdropper or a man in the middle, as it is called, in the security parlance, they're not able to intercept the information and make sense out of it or misuse it. From the privacy perspective, the requirements are related to accessing the information and ensuring that only the right people have access to the PHI. And this means scoping the information to make it available selectively to people who need to know. And if there is a sharing of information, the key requirement is that the patient should be authorizing sharing of any information. So the patient is in the loop, the patient decides what, if anything, gets shared, and who accesses that information is really part of the privacy requirements. So HIPAA audit. So let's talk about what is happening on the HIPAA audit side. So as we know, in 2012, OCR had done some random audits. They had hired KPMG to do roughly about 150 to 200 random audits of covered entities. And this was actually shared with me by one of our partners. So what OCR is now saying is that they're going to roll out a permanent program in 2013. We suspect sometime in the August-September timeframe, which will essentially cover looking into privacy, security, and breach notification rules in all the detail that I talked about. And so it's no longer an option. It's no longer something that will happen in the future. This is something that the OCR director has announced, I believe, today or yesterday. So this is something that all of us need to be aware of, especially in the healthcare space, that that is something that we need to be prepared for. And the HIPAA HITECH enforcement bandwagon is moving forward pretty aggressively. So the question is, as a business entity, as maybe a partner who's working with the business, what are the things that covered entities and business associates, what can they do to put together, by learning through the best practices that are out there, what can they do to put together a security and compliance plan that will help protect PHI and to deal with the privacy and security issues and move in the direction of preventing breaches so that PHI information is secured, it doesn't get into the hands of people who don't need to see the information. So let's start with privacy. So privacy-wise, the idea here is to ensure a set of training and personal authentication mechanism. Authentication is essentially a way of ensuring that only the right people who need to know the information gets access to it. And the recommendation here is to use what is called a multi-factor authentication. So instead of a simple username password, which is typically the case, have another level of security to ensure the right person indeed is accessing the information. And then couple that with the concept of limited data set for sharing, which means that the PHI information needs to be broken up into smaller units of information, and certain people will only access certain kind of information based on what they're trying to do with PHI. So don't expose the complete set, and ensure the right people are accessing the information by using multi-factor authentication. So what should we do on the security side? So I mentioned about 10 best practices. So let me take you through that. And these 10 best practices, as I said earlier, will help ensure creating a robust security and compliance plan to prevent breaches, to prevent hopefully misuse of data. So the first step in any security and compliance plan is to figure out where do I stand as a business entity with respect to the requirements. And that can be achieved through a self-assessment. A self-assessment essentially results in what is called a gap analysis, which tells me, given the requirements, how far away am I as a business from that, meeting that requirement. And along with that is a risk analysis, which tells me that what is the level of risk do I carry by having these gaps in place. And so risk allows you to prioritize and fix problems which are more important than the others. And then this is also required for showing what is called meaningful use that I talked about. So knowing the gaps and the risk analysis, and then assigning it to owners, identifying owners in the company who are tasked with the responsibility of dealing with security and compliance issues is again very key that I'll cover in the 9 steps for dealing with HIPAA HITECH audit as well. Second thing is to understand what are the vulnerabilities. So we talked about gap analysis, understanding the risk. Another dimension of the vulnerability is to ensure that we understand from the technology level what are the threats, what are the vulnerabilities, and that ties into the risk level associated with these assets that are sitting in the business, and they're prone to breaches, they're prone to misconfiguration. Maybe some default passwords are set in certain assets that can be broken in easily. So we need to ensure as a business that every aspect of the business, whether it's IT assets, whether it's people, personnel, all aspects of the business, people, process, and assets are secured. So we are kind of walking through the different ways of doing that. And this is also required for showing meaningful use, as I said earlier. Encryption is a huge requirement. And the idea here is to ensure that any PHI information, no matter where it is sitting, or if the information, patient health information, is being transmitted over the net, it needs to be encrypted. And what does encryption do? It ensures that if somebody intercepts the information, either on your mobile handset or over the wire, they cannot make sense out of it unless they have the encryption keys. So there are technologies available to ensure encryption is a useful way of dealing with misuse of PHI if it happens to be exposed for whatever reason. Now, I talked about businesses, covered entities have a shared responsibility to ensure that BAs and any vendors that they work with are also implementing HIPAA HITECH privacy and security requirements. So how do we ensure that? That's done through a BA agreement, a business associate agreement. And in the business associate agreement, there needs to be explicit information and requirements to ensure that they are indeed legally liable and are taking steps to deal with the HIPAA HITECH compliance requirements. So vendor management is an important activity, important part of the security and compliance plan to ensure dealing with HIPAA HITECH requirements. And this involves even shredding companies, people who collect, companies who do garbage collection and compaction. They need to be in the purview of that. Any lawyers, any hosting companies, EHR, electronic medical record or electronic health records, hosting companies and providers, service providers who are hosting your servers in the cloud, they all need to be having a BA agreement with the covered entity to ensure privacy and security of the HIPAA HITECH and PHI data. So market research has shown that cloud and SaaS-based services actually minimize the risk of misuse. And the reason being that as a small to medium-sized company, sometimes you may or may not have the resources or security resources to safeguard and put together security best practices. And even for medium to large enterprises, companies like Amazon or other Rackspace, they have put together a lot of investments in the security space. And so the market research out there tells us that using cloud and SaaS-based services leads to minimal risk of misuse compared to hosting and doing it internally and all by yourself. Using multi-factor authentication, this is something that I mentioned earlier. It's not enough just to have a simple username password. Have another level of security, and if you go to a finance portal or a bank portal, this is something that they do on a routine basis. The idea is that you're trying to put together multiple challenges in front of the user who's trying to access or do certain actions. And the intention is to filter out people who are trying to misuse the system. Social media policy. In this day and age, Facebook, Twitter is fairly common. And a number of breaches, actually, you might have already come across this, but a number of business associate related breaches happen because somebody put out the patient records on Facebook in one example, or they shared it on an online portal. So training employees, putting together a social media policy so that everybody understands what are the do's and don'ts, and creating a corporate culture that essentially communicates the patient's rights and the privacy and security guidelines is very key to a successful security and compliance plan. Document shredding is an important part because PHI can be in physical form, it can be in the form of papers, or it could be in electronic form. So if you have physical papers, they need to be trashed in a secure fashion. If you have tapes and storage media, they need to be dealt with in a particular in a manner that allows total destruction of data, and it cannot be reverse engineered to get the actual bit. So there are guidelines available to ensure complete destruction of PHI, whether in physical or electronic format. And the final best practice is to ensure accidental misuse. And sometimes it's accidental, sometimes it's a disgruntled employee walking out the door who's kind of downloading all the data and intends to cause harm. But the idea here is to ensure something called a policy-based access, which essentially means, in simple terms, that certain users should be allowed to access certain kind of data, and that should be guided by some kind of a policy that's implemented through technology. Sometimes DLP, which is a data leak protection technology, is an example of that implementation, where you are not allowed to do certain actions if you don't have the rights to do it. So these are the 10 steps that 10 best practices that I talked about, which are essentially the foundation of a comprehensive security and compliance plan. It deals with assessing where you stand, understanding the risk level associated with your current position and current posture, and then taking steps to secure the data, to deal with privacy issues, and to deal with accidental misuse. So these are, as I said, the fundamental building blocks of a security and compliance program. So having said that, now let's jump to the interesting part of, so what can I do? How can I prepare for an OCR audit? And I'll show you 9 steps which are described here, and then I'll talk about AG5 Secure GRC, which allows you to automate the entire process using a subscription-based service. That's and I'll give you a preview of that in the next 10 to 15 minutes. So first thing is to understand, what do I need to do? What does HIPAA HITECH mean for me as a business, whether I'm a covered entity, whether I'm a business associate, whether I'm a subcontractor dealing with a covered entity or a business associate? What does HIPAA HITECH mean to me as a business entity? And then formulate a security and compliance plan, and some of the 10 building blocks that I talked about will form part of that. Now, not everything may be required if you're a subcontractor. Most of it would be required if you're a business associate, and all the 10 building blocks would be required if you are a covered entity for sure. And the next thing is to identify people in the organization who are responsible for being the champion, for being the leader, for dealing with the security and compliance issues. For very small businesses, we see that typically being headed off by maybe the administrator, office manager. In the mid to large size businesses, typically there are IT managers or security officers who are dealing with this. and a number of our partners who are dealing with some of the medium to large customers, they manage and they act as the point person for some of these businesses. But the key thing here is to understand who's responsible, and there's a process of education and training that goes through the organization that needs to be implemented. And then start off by saying, where do I stand? What's the gap between the requirements and where I sit as an organization? What's the risk level? And what are the asset vulnerabilities that exist today? Understanding all of this will help the business understand what's the risk level, what are the most important threats, what are the most important risk levels that I face as an organization. And the risk analysis will tell us very clearly what those issues are, what specific controls, what specific means and methods are missing, and this should be performed pretty regularly, at least quarterly, if not once every 6 months or once a year. And this is also required for getting the meaningful use dollars that I talked about. And once we understand the gaps, the risk levels associated, then comes the fun part of remediation, putting together safeguards and controls and mechanisms in place to ensure that somebody is responsible for monitoring that the gaps do not happen again, and if they happen, what are the mechanisms in place to deal with it so that the company is not exposed, that we don't become out of compliance, HIPAA HITECH compliance, and we're not exposed to external breaches. And of course, reward and penalty is part and parcel of that to ensure that roles are assigned, the policies in place to report breaches if it happens, and point persons need to be accountable. And at the end of it all, once you go through the whole process of remediation, the result is an attestation of compliance, which is really a proof of compliance, which is also called report on compliance, and that becomes your proof that you've taken steps to deal with all the security and compliance issues, and this needs to be repeated regularly. So just to summarize, there are a set of steps which involve people, process, technology, and putting together a security and compliance plan that is required to ensure the privacy, security, and other HIPAA HITECH audit requirements are met. And this is an ongoing process. This is not a point in time that you do it once and forget about it. Security and compliance is a constant process of renewal. It's a constant process of keeping on top of things that may go wrong. If there's a new employee that joins, or a new employee that, or an earlier employee that leaves, bad things can happen. So it needs to be constantly renewed. It needs to be constantly monitored, and that's where some of the challenges also come in. Now let me change gears and talk about AG5 Secure GRC. The current landscape of products that are out there are mostly very expensive. They're very manual intensive in that they need a lot of customization on a per business basis. So when we set out to design and launch this product, one of the key requirements was to make security and compliance accessible for healthcare, for the healthcare community. And we address small businesses all the way to large enterprises. And by putting it in the cloud, we essentially make it very cost effective. There's no hardware requirements. It's a subscription model, and there's very little customization needed on a per business basis because we have different editions to suit different business sizes. So the solution does security monitoring and IT GRC management. It has built-in support for HIPAA HITECH, but other frameworks as well. It has built-in support for vulnerability management, and it includes BA management and vendor management. So as I said earlier, all the requirements that are required for an effective security and compliance plan, or to get meaningful use dollars, or to deal with HIPAA HITECH audit requirements. All of that is built into the tool, and it's totally automated and integrated. And the tool also provides best practices, policy and procedure templates. I'll show you some examples of that comes built in, packaged with the tool. And cost effectiveness is a key tenet of our solution. This solution has been designed from the ground up to be delivered through channel partners, and also it's cost effective because we don't need any hardware, and we want this to be adopted by businesses of all sizes. This is the workflow supported by the tool. I won't go into the details, but suffice it to say that the whole cycle, the continuous cycle for dealing with security and compliance issues, whether it's assessment, doing the gap analysis, doing the risk analysis, putting together a set of best practices and training, is all built into the tool, and this process can be repeated at will. You can schedule the vulnerability scans, and everything is done through the cloud. So there's very little, there's no hardware required. Everything is done through a piece of software that does it automatically for you. The different editions of the software that's available depending on the size of the business. So standard edition is meant for small to medium businesses. Medium to large enterprises typically would use professional edition. There's a vendor management module. There's a security posture management module, which deals with asset discovery and vulnerability management, and it automatically maps it to security controls so that you don't have to manually deal with the headache of understanding how vulnerabilities are going to be affecting your compliance controls. And the same platform, the same solution scales up, as I said, from small businesses all the way to tertiary hospitals, state hospitals, and the different editions will basically deal with requirements for different size of the healthcare entity-wise. And the HIPAA HITECH requirements are scoped based on the size of the business, and it automatically understands, given the size of the business, what requirements are required for that size, etc. To give you a flavor of what the tool does, I'll show you in the next 5 minutes some snapshots from the AG5 Secure GRC tool. So this is the dashboard that you get when you subscribe to the tool, and the tool will go out and discover the assets and tell you your current security and compliance posture. In this case, it's telling me that my security risk is at critical level and my compliance level is high, which means I have certain assets and vulnerabilities that need to be fixed. The model of self-assessment is based on a yes or no questions, and we have broken down the HIPAA HITECH requirements into very simple yes and no questions. And the idea here is that we provide them with copious help that allows them to answer the questions yes and no. They can upload evidence as part of their answers, and we provide built-in policy documents that might help them understand how to go about implementing some of these requirements. So this is built into the tool. You can click and get access to it, and you can customize these policy documents. There are business associate agreements, for example, as a policy document that's available that tells you exactly what you need to do to ensure privacy and security of PHI data and how it needs to be shared with subcontractors and vendors. There's lots of help available right in the tool, which allows you to understand how to interpret the requirements. It tells you as to what businesses would typically do to implement the requirement, and every question has a risk rating, which essentially tells you how important or less important it is. And vulnerabilities is again, as I said earlier, you can do a security scan. You know what your top vulnerabilities are. It'll tell you the top 10 vulnerabilities that exist in the system, which assets are affected by it. It'll also tell you how to fix those problems. Maybe there are certain patches missing. Maybe there are certain default passwords that need to be changed in your server sitting there, or on the web, or on the fax machine that needs to be configured properly. So all of those issues are pointed out, and the net result of all this is a report on compliance, which tells you your current status with respect to where does the business stand with respect to the requirements. You can also get a quick survey done for all your business associates through the tool, and it'll tell you where do your business associates and vendors stand vis-a-vis the requirements from HIPAA HITECH perspective. And it's got email templates that you can use to enforce and work with your business associates and vendors. So just to summarize, I know I went through a lot of information today, but just to summarize, the first few steps that one needs to take is to understand where does a business stand with respect to the HIPAA HITECH requirements. And doing a self-assessment, doing a gap analysis, doing a risk analysis is the first step in that direction. Putting together a sustainable plan with owners, with roles and responsibility is a key foundation for any business who's interested in dealing with HIPAA HITECH requirements. And the key thing is to protect PHI. For whatever reason, if there's a breach that happens, put together a breach notification plan to deal with that eventuality. So be prepared, take proactive measures to ensure all these actions are taken. Otherwise, when an audit is done or a breach is done, you might be caught unawares. And Secure GRC allows you to automate the whole process. It allows you to do the security risk analysis to show meaningful use, which is required for getting the federal stimulus dollars that I had mentioned earlier. You can use AG5 Secure GRC to implement a vendor management and a BA management program. And if you're interested in knowing more about it, please feel free to reach out to me. I'll give you my contact information at the end. If your IT service provider does not support it, and if you would like them to look at it, please reach out to us again. So, and I have a lot of references here at the end. Let's open it up for questions now. Mike?
Great. Thank you, Anupam. Thank you for presenting. We'll open it up to questions. We already have a bunch of questions in the queue here, Anupam, so I'll go ahead and start asking. Here's our first question. Are these audits independent of the MU recipients?
That's right. If I understand the question is audit independent of the meaningful use recipient, correct? So the answer is yes. The audits are being done randomly, and of course there's another requirement that if you've claimed the meaningful use dollars and you are found to not comply with HIPAA HITECH, that's a separate branch of action. But yeah, they're totally independent as of now.
Okay, great. Thank you, Anupam. How can you ensure encryption, since the encryption both in transport and storage are primarily part of the EMR vendor?
Yeah, so there is the EMR vendor sort of implementation that supports encryption or not. But I'm also talking about dealing with EMR information, which might be sitting on the laptop, or somebody might be accessing it remotely, and all that access and sharing of EMR, electronic medical record information, needs to be secured through all the encryption. So for example, if you have a laptop with patient records lying around, for whatever reason you downloaded it from the electronic medical records, which is in the cloud, that needs to be protected. Any form of access, sharing of PHI information needs to be protected, and encryption is one of the means of doing that.
Great, thank you, Anupam. Do the HIPAA audits extend to all medical practices, whether they accept HITECH money or not?
That's correct. They're going to pick, last year they picked 150 to 200 random organizations, and while meaningful use could be a trigger, but it's not necessarily the requirement that they would be audited only if they sought meaningful use dollars.
Please explain, oops, sorry, I skipped one. Are there ways for BAs to protect themselves from audits if medical offices do not implement suggested policies?
Could you repeat the question? I lost you a little bit there.
Are there ways for BAs to protect themselves from audits if medical offices do not implement suggested policies?
So the question is, if I don't implement the policies, can I protect myself from being audited if I'm a BA?
Yeah, more frank, yeah.
Yeah, so as a BA, the requirements for complying with HIPAA HITECH is pretty similar to that of a covered entity. Give or take a few requirements. So yes, policy requirements is certainly an important part of that requirement to ensure HIPAA HITECH compliance. And that is absolutely required from the BA perspective.
Okay. Next question. Please explain how the BA add-on works with the two tools. Does it include vulnerability scans for the BA or only the CE?
Yeah, so the vulnerability scan can be added on to both the covered entity or the business associate. And the business associate module is a separate module that you can add on to the covered entity. So covered entity is, the assessment for covered entity is more or less similar to that of a BA with some changes, as I said earlier. And you can add on vulnerability scanning to either the covered entity or BA, depending on what you want to do. So it's pretty much flexible, and you can mix and match.
Great, thank you. Next question. I backed up PHI data to a cloud vendor like Amazon, where it's encrypted and stored in several small files, which cannot be reassembled without encryption keys. Does Amazon in this case need to execute a BA?
Yeah, in fact, if they are storing PHI, then they do. And in fact, Amazon has, when I last checked, they do have a HIPAA HITECH compliance document that explains what procedures and policies they undertake to ensure that. But yes, if they are storing EMR data, and you should be asking them that question to ensure that they are safeguarding the data.
Is there a reseller program for IT companies?
Absolutely. Please, we have a full-fledged partner program, reseller program, which allows you to package this, resell this tool to your customers. Would love to hear back from you. You can see my contact information here. Drop me a note, and we can take it from there. I can bring in my VP of Sales to take it from there.
We have some requests to see the slides or to get the slides. You can email Anupam at this email address on the slide right here. And you can also view the recording. We're going to put the recording up on eGestalt's website in the next day or so as well. Next question. Is there an easy way to identify the additional requirements for HITECH and MU attestation compared to HIPAA requirements? This might be a typo. I don't know if that makes sense.
Yeah. So yeah, I think the question, if I understand it correctly, is that what are the additional requirements coming from HITECH and meaningful use? Yes. So there are additional requirements coming from HITECH and meaningful use. In fact, HIPAA omnibus rules reinforces some of the requirements that came in from HITECH, and the tool will help you sort through the different categories of requirements, whether they come from HIPAA, or whether they come from HITECH, and you can also create a report for meaningful use right from the tool. So if you need more information, would love to, please reach out to me, and we'll get you the information specifically that you're asking for.
Great, thank you. We have a bunch of questions still left in this queue, Anupam, and we're running out of time here. We're coming up at the top of the hour. So what we'll do is I'll gather all the questions and send them off to Anupam, and he'll reach out to each of you individually with answers to your questions. And additionally, if you have any questions after the webinar, feel free to email Anupam at the email address on the screen right there. All right, and like I said, we've recorded this webinar, and it'll be up on eGestalt's website in the next day or so as well. Okay, well, thank you to the attendees for attending today's webinar, and Anupam, thank you for presenting today. Have a great day.
Thank you very much. Good afternoon.